Welcome to this tutorial about non-invasive monitoring of drugs bioavailability by tissue impedance measurement. This will be carried out by myself, Pasquale Arpaia, and Nicola Moccaro. This is the outline of our tutorial, where you can see a main topic related to introduction of the exploitation of prosthesis, osseointegration, diagnostics in audiology. And then you can see a further important point related to the exploitation of impedance spectroscopy for drugs absorption assessments in aesthetic diabetology, and namely, we will highlight the results of our experimental activity in all the case studies. Let's go straight ahead on what is the main problem in osseointegration. You can see here a picture where we have on the left the titanium of the prosthesis and the bone. This is the situation of perfect osseointegration. You can also see the situation, schematics of an application, topical application in dentistry. What's happened if there is not a perfect osseointegration? You can see now the situation on the right, where you can see, namely on the centrum, the birth of an undesired connective tissue, which is zoomed, highlighted here, and this interface will destroy the firm adhesion, the firm integration between the prosthesis and the bone. So we will have a low contact surface, implant bone, and obviously a successive physiological rejection. So what is the main first idea of our innovation? Exploit the EIS, namely the electrical impedance spectroscopy, in order to diagnose the situation of the interface between bone and implant. The measurement method is illustrated in the picture you see here, where you can see the bone, the fixture, which is emulated by a screw, and a typical 3 electrodes configuration. You can see also here what's happened when the current applied by the electrode is passing through the multi-layer tissue, where we have the skin, the fat, the muscle, the prosthesis, and the interface tissue, which is anomalous, which is undesired, before to arrive to the bone. Obviously, in the impedance spectroscopy, a sinusoidal stimulus is applied, and then the effect in terms of difference of potential is recorded. A further idea is that we have to deconvolve the response to the electrical stimulus from a complex multi-layer tissue. So we need further measurements. The idea is that we can exploit the nonlinearity to increase significance. It is, in our opinion, well explained, well highlighted in the picture, in the diagram you can see here. You can see that we exploit, in the diagram voltage versus current, we exploit different position, different working points to achieve different independent responses at varying the bias of the voltage applied during the measurement. So we can see that at varying the V bias, the bias voltage, and then at varying the working point, we exploit the nonlinearity, which is obviously a serious drawbacks in the measurement that we face by using a small amplitude by approximating a linear condition. So if we work in different conditions macroscopically of this characteristic, we can affirm that we have independent measurement. So we increase the significance of the measurement. This means that we are applying an important principle. We do not see problems, but conversely, opportunities, chance. This is the in vitro instrumental setup. You can see the results of the in vitro validation, where the nonlinearity gives rise to independent spectra for multilayer tissue identification. So at varying, you can see here, illustrated by different colors, how we have different responses at varying the bias voltage. Then the osseointegration level is emulated by progressively unscrewing the screw emulating the prosthesis. In particular, as much is unscrewed the screw, as much the level of osseointegration is worse, because the contact between the screw and the bone is worse. Here you can see the results of the in vitro validation. And you can see how, at varying the number of unscrewed turns, the osseointegration varies. And there is a significance from the point of view of the measurement not compatibility. So these results points out both in terms of both the magnitude of the impedance and Nyquist complex of the impedance. You can see how, at varying the number of turns, the answer is significantly different. Let's see the further audiology cochlear implants. You can see here the mechanism, how the implanted hearing aids works. The sound is received by the skull cap, and the piezoelectrical sensor integrated into the skull bone transduces sound vibrations into electrical signals. Then electrical signals are sent magnetically into the ear to the electrodes implanted into the terminals of the auditory nerve. In this way, the skull is used as a transducer of the sound. In this picture, you can see a typical configuration of the audiology cochlear implants and a typical setup of our experiments for measuring the quality of the osseointegration of the cochlear implants. You can see here, analogously as in the other case study, how at varying the time of osseointegration, how the modulus of the impedance, the magnitude of the impedance is going to change. Also in this case, we have a significant difference in the response of the spectrum.
Hi, welcome to the second part of this tutorial. Now we come to illustrating drug bioavailability measurement based on impedance spectroscopy. We began our research aiming to find a method for measuring the amount of drug actually administered after transdermal delivery in aesthetic medicine field. Topical and transdermal drugs are employed with the twofold objectives of minimizing the systemic uptake and concentrating the action at the seat within the skin. In this video, you can see an aesthetic electroporation treatment. Transdermal delivery effectiveness is evaluated by numerous studies in laboratory. However, performance outside of the laboratory in the context of daily clinical application is less investigated. The absence of effective and standardized in vivo measurement methods for locally acting drugs makes it problematic to ensure that the drug has met its target. At the beginning of our research activities, we conducted a campaign of exploratory measurements based on eggplants. Eggplants and human tissue have important electrical similarities as demonstrated in the literature. The campaign was meant to investigate a relationship between the injected drug amount and the impedance variation and its uncertainty sources. Rectangular-shaped pulp sample blocks were derived from eggplants. Impedance spectroscopy was carried out by using a Solartron 1260A impedance analyzer. Pre-gel electrodes with one of the largest surfaces on the market were selected in order to mitigate the impact of the contact on the measurement. A commercial drug with a conductivity of 500 Siemens per centimeter was injected. By incremental step of 400 microliter, and a sinusoidal current of 1 milliampere was applied to the electrodes. The voltage drop was measured in the frequency range from 1 Hz to 10 MHz. The impedance spectrum was measured before the injection set and after each injection level. In the above experimental condition, a linear relationship between amount of injected substances and impedance spectrum was surveyed. In particular, the typical Bow diagrams in the figure on the left highlight an increase in the injected amount of the drug, determining a related progressive decrease in the impedance magnitude, whilst the trend on the face on the right seems to be not so regular. Further measurements were realized on eggplants. By a design of experiments approach, the statistical significance of different measurement parameters on the measurement sensitivity was assessed. The electrode gap resulted the most influenced parameter, followed in order by the electrode area, signal frequency, drug conductivity, and signal amplitude. An optimum configuration was also predicted by means of the design parameter effects, maximizing the sensitivity. It is worth to note that an increase by about 25% in drug conductivity produced a corresponding sensitivity improvement of about 12%. The method was also tested on pig ears. According to the literature, pig skin appeared as the most suitable model for human skin. Analogously, as for the experiments on eggplants, a linear trend was experienced. The more drug amount injected, the wider the magnitude impedance variation with respect to the initial value. For the in vivo experiments, water-soluble sodium salt of hyaluronic acid with conductivity of 1.3 millisiemens per centimeter was used. The depth of injection was 0.5 centimeter below the surface. The experiments were repeated for 10 times on 8 subjects for 5 steps of successive volumes of injected drug. A linear behavior was again found as shown in the figure. The results reported refer to the overall means on each sample. In the case of sensitivity, a fairly large difference was shown by different subjects and an inter-individual reproducibility problem arose. A problem largely known in medical research. Each individual reacts differently to the same treatment, and also impedance spectroscopy keeps this trend. How could it be possible to manage this high intrinsic uncertainty exhibited by the measurements? A different application of this method seems to be heavily promising to this aim. In diabetology, an important challenge is the estimation of the insulin sensitivity factor and insulin duration of action. They can be subject to relevant variation depending on the kinetics of the insulin absorption. Skin alterations such as lipohypertrophic nodules are the main causes of intra-individual variability in insulin absorption. Non-deterministic insulin trend absorption is an high-risk source for diabetes patients. Also in this field, there is a lack of an in vivo method for the insulin bioavailability assessment. We have proposed our method for real-time assessment of systemic insulin absorption by measuring drug disappearance from the injection site. In this case, we took advantage of a favorable condition, having to measure a disappearance, that is absorption. We could use the appearance phase to identify a custom model. Increasing gradually the amount of drug while measuring impedance variations allows to build a peculiar relation for a specific tissue. The relation is highlighted by the linear regression line, that is an insulin appearance model. The insulin impedance model can be employed during absorption measurement for assessing insulin disappearance and thus bioavailability. This allows to improve significantly inter- and intra-individual reproducibility. In this slide, we can see how to use the relationship built during the injection phase for estimating the amount of drug absorbed. After the insulin injection at the time t0, an impedance measurement detects a percentage variation of minus 12% with respect to the impedance value before injection. Using the comparison relationship, it's possible to estimate around 0.09 milliliter of drug still in situ and therefore not absorbed. At the time T1, an impedance measurement detects a percentage variation of minus 6% with respect to the impedance value before injection. In this case, 0.02 milliliter of drug are estimated to be still in situ. The drug is therefore quite all absorbed. In this picture, you can see the architecture of the proposed insulin meter based on the personal model identification during the injection phase. After in vitro and ex vivo tests, also preliminary in vivo tests were carried out in order to validate the proposed meter on a voluntary human subject affected by type 1 diabetes. A commercial injectable solution of insulin in a configuration of 3-field pen was used. The experiment was carried out by measuring through the insulin meter the impedance just during the bolus injection of the patients. The same setup with inter-electrode distance 5 mm and injection depth 4 mm was used. Insulin was administered at a successive step up to final amount of the patient therapeutic value of 0.1 milliliter. For each administration step, the impedance was measured according to the protocol established in vitro and ex vivo tests. In the graph below, the typical results of the experiment are reported. A monotonous increasing trend is inferred, and the model is proved to be useful also on human subjects, as well as optimal to describe the trend of the phenomenon already identified in vitro and ex vivo tests. Thanks for your attention.